There's a lot of misconception when it comes to headaches. Migraines are very specific. A migraine headache is specifically unilateral, one side of the head. They're often a severe form of headaches. There can be different triggers for these. A lot of people have food sensitivities that can trigger a migraine, postural habits that can trigger a migraine. Light sensitivity is another big one that you'll see often. There's often nausea associated with it. Some people can have neurological symptoms associated with it. Numbness, tingling, weakness down the arm or even into the face, which then leads into even more difficulty with diagnosis, because a lot of those symptoms are also things that you would see with more sinister and severe cases. So diagnostic criteria is very important. Thorough examination is very important. We want to make sure that what we're dealing with is actually a migraine headache. If after we go through that checklist, if it does appear to be, then we can then jump into treatment options for it. A lot of the treatments we do in here, they're similar for headaches as general, but with the migraine specifically, they respond really well to soft tissue therapy, massage type stuff to the suboccipital muscles at the top of the neck. They respond very well to cervical manipulation, especially the upper cervical spine, the occiput C1, C2. And then as well as lower in the neck, the cervico-thoracic junction, that mid to upper back area as well. Decompression therapy, which we've talked about in other videos, is shown to be very beneficial for the migraine type headaches. And then with a lot of my patients, I also like to talk about lifestyle changes and modifications. It's important to hammer down what someone's trigger is, whether that's food, stress, light sensitivity like we talked about. And then once you kind of know the trigger, we can then talk about ways to avoid it, reduce the severity of the migraine. That way it's not as debilitating for, the patients that are suffering with them.